Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a March 8th, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 new case trend line is trending downward with 72 cases reported in the last 7 days. The age groups with the most cases this past week is the 19 to 24-year-olds and the 30 to 34-year-olds. However, all age groups are getting infections. Iowa has detected 20 B117 variants through sampling at the State Hygienic Lab. On February 15th, we only reported 8 cases of B117, and nationally, 531 B117 cases have been reported since March 4th. Dubuque County continues to successfully administer all of the vaccines we are allocated, either from the Iowa Department of Public Health or the Federal Retail Pharmacy Program. As of today, 11,070 people have been vaccinated with 1 dose, and 11,115 people have completed their vaccination series, which is over 10% of Dubuque County's population. In total, 33,300 doses of vaccine have been administered. And we also administered 200 with the Janssen vaccine to people in Tier 2 or Tier 2 manufacturing and distribution workers. Unfortunately, due to supply and distribution issues, we won't be receiving any more Janssen, which is the Johnson & Johnson vaccine, until sometime after March 25th. Although 59% of the vaccine has been given to those 65 and older, that group still has a lot of people that need their vaccination. So we're going to continue administering to this most at-risk population, but those in other priority groups will also be allocated some of our very limited vaccine supplies. Please continue to be patient, since there is not enough vaccine available at this time to give it to everyone who qualifies. So now you're probably thinking, how can my behavior change when I'm fully vaccinated? Which, by the way, isn't until 2 weeks after the second dose is received. People who have been fully vaccinated can start to do some of the things they had stopped doing because of the pandemic. We're still learning how vaccines will affect the spread of COVID-19, so after you've been fully vaccinated, you should keep taking precautions in public places like wearing a mask, staying 6 feet apart from others, and avoiding crowds and poorly ventilated spaces until we know more. But here's some of the things you can or could do once fully vaccinated. You can gather indoors with fully vaccinated people without wearing a mask. You can gather indoors with unvaccinated people from one other household, for example, visiting with relatives who all live together, without masks, unless any one of those people or anyone they live with has an increased risk for severe illness from COVID-19. Also, if you've been around someone who has COVID-19 and you're fully vaccinated, you do not need to stay away from others or get tested unless you have symptoms. There are some extra precautions if you live in a group setting or a home if you've had an exposure. If you've been fully vaccinated, you should still take steps to protect yourself and others in many situations because not everyone has been vaccinated yet. So you'll have to continue to wear a mask, staying at least 6 feet apart from others, and avoiding crowds and poorly ventilated areas. So take these precautions whenever you are in public, gathering with unvaccinated people from more than one other household, visiting with an unvaccinated person who is at increased risk of severe illness or death from COVID-19, or who lives with someone in that situation. You should still avoid medium or large-sized gatherings. Delay domestic travel and international travel, but if you do travel, there are a lot of CDC requirements and recommendations you must follow. Finally, you should still watch out for symptoms of COVID-19, especially if you've been around someone who is sick. If you have symptoms of COVID-19, even though you're vaccinated, you should get tested and stay home and away from others. And do not forget, you will still have to follow guidance at your workplace, and the city and county mask requirements are still in place for those public places. As more and more people are fully vaccinated, all of this guidance on what you can and can't do will become easier to follow. In the meantime, Continue to wash your hands, wear a mask, keep your distance from others, and stay home when you're sick or exposed to someone who has COVID-19. The good thing is we can now meet up and have a chat with someone outside in this emerging spring weather. So continue to stay safe, everyone. You know the drill. We're all in this together.